Originally, we intended the Wildlife Center to be a local clinic for injured and orphaned wildlife. However, we soon recognized that most of our patients were directly or indirectly the victims of human activity. To really help wildlife, we needed to change human behavior. The best way to do that was to tell the stories, the real-life stories of our patients. They are the living proof of what happens when people don't think about the consequences of their actions. Even simple choices we make in our daily lives can have profound implications for wildlife. Our patients are the teachers, and we are just their messengers. The Wildlife Center is a teaching hospital that teaches by example. We're currently expanding our facilities and enhancing the quality of the care we provide. We're working to increase the number of students and professionals that can train both on-site and online. Perhaps most importantly, we're dramatically increasing our outreach to the general public, inspiring them to care more about wildlife and teaching them how to care for the environment and the wild animals with which we share it. To achieve these ambitious objectives, we must enhance our physical infrastructure and upgrade the technology used to support it. Even as the leading wildlife hospital in our part of the United States, we can't be all places at all times. So we use technology to extend our reach and expand our impact. Using the internet and social media, we now reach more than 1 million people each year with the stories of our patients and our conservation message. The use of this technology for telemedicine also allows us to assist animal care facilities around the world with diagnosis and treatment of injuries and disease, and to quickly get help for distressed animals, no matter where they happen to be. At the Wildlife Center, we try to use new strategies and new tools to work smarter, not just harder. Without growing the size of our organization, we have dramatically increased our impact. At the Wildlife Center of Virginia, we always focus on our mission, and we try to think strategically. We effectively integrate our veterinary, outreach, conservation, and administration programs. This allows each staff member to benefit from the expertise, experience, and perspective of every other. While we have 4 separate departments, we truly have one cohesive team of professionals. We also strive to be exceptionally good stewards of the support we receive. We constantly look for ways to use the support we receive from one source to attract support from another. We actively recruit and utilize non-monetary contributions as well. As a result, we generate $2 worth of wildlife conservation and care for every dollar we receive in private contributions. Above all, we never forget that the support we receive is really other people's money, entrusted with us so we can make a difference that is meaningful to the donor. Of course, one measure of our success is how many animals we treat. Since the Wildlife Center was established, we've treated more than 60,000 wild animals, representing nearly 300 species. However, our mission is about teaching. Therefore, our true measure of success is how many people we reach with our conservation message. In the first 28 years, we reached 1.5 million people through our face-to-face programs. In 2010, we made a strategic decision to move aggressively into the digital age through the use of streaming video, webcams, social media, and live discussion groups. The center now reaches more than 100,000 people each month, engaging a worldwide audience in the effort to conserve wildlife. While the care of individual animals is certainly the most heartwarming aspect of our work, the collection of data about the environmental threats facing wildlife may be the most significant. The center is currently sharing wildlife health data with state and federal agencies responsible for public health and, indeed, national security. Wildlife is, in effect, the canary in the coal mine. What affects wildlife will eventually affect humans. Each patient provides potentially critical insight about the environment, emerging disease, and the threats to our shared future. There are so many things we've accomplished over the years, but there are a few that stand out. We identified the threat to wildlife caused by the granular pesticide carbofuran, which was found to be killing an estimated 2 million birds per year. We then led the nationwide effort to ban this killer. Additionally, the center has provided in-depth, on-site training to more than 1,000 veterinarians from 40 countries. In 2007, our unique blend of soft heart and hard science earned the Wildlife Center the designation of the Conservation Organization of the Year for the entire United States. Saving individual animals is very appealing, but the real contributions we make to conservation, wildlife health studies, professional training, the development of new technologies, are more subtle. Finding the resources for these critical initiatives remains a challenge. The center has developed new, more effective treatment protocols. We've launched an online wildlife health database which helps compile and analyze information from wildlife care facilities nationwide. We've developed better ways to communicate the conservation message to the public. All of these advances rely on the use of technology. With additional resources, we'll do an even better job of teaching those new protocols, distributing our data collection tools, and sharing the communication strategies with colleagues worldwide. There is an important unmet need for trained wildlife care professionals worldwide. At the center, we want to do even more to meet this need. Our unique blend of veterinary care, public education, and public policy engagement is a model for conservation organizations everywhere. By expanding the pool of competent professionals, the impact we have had can be amplified and sustained far into the future.